Another thing I'd like to talk to you about is Invisalign. Invisalign is essentially clear trays that move teeth, so it's braces without the metal brackets and wires. Very popular today for the adult population. And the leaders in Invisalign dentistry who have done thousands of cases are arguing that we're getting to the point now where Invisalign may actually replace conventional orthodontics, meaning we won't have wires and brackets. We'll just have clear trays or some level of that will move teeth. And that's what the technology is getting at. It's pretty phenomenal. What we do is we actually take some records, we get some photos and x-rays and some models or impressions of your teeth. Those go down to Santa Clara and they actually do a CT scan of your models that goes into a three-dimensional program on the computer. We then treatment plan your case on the computer, whereby we're looking at a three-dimensional models and we're moving your teeth to where we ideally would like them to be. What the technology then does is it determines how many sets of trays will it need to move the teeth to that position. So let me show you the trays. So let's take a look at the trays. This is an Invisalign tray. It's a hard, clear plastic tray. People wear these and their colleagues and friends often don't even know they have anything in their mouth. They're pretty firm and they snap onto the teeth nice and solid. Now what these trays do is they're fabricated with in mind that tooth, we want to move that tooth a little bit. It can rotate teeth, it can move them out, in, up and down, all the different movements. So that tray will put pressure in just enough a certain area so that tooth will move. So what we do is we go to the final goal of treatment and then we backtrack, and the technology will actually make stereolithographic molds of your teeth at each sequence and then fabricate different trays for each sequence. So you may have, say, 20 trays in your treatment. You may have only 10, you may have 30. It depends on how much movement we want to accomplish. You'll typically wear a tray for 2 weeks. That'll be enough time to apply the necessary pressure to get that level of movement, and then you'll put that one away. You'll go to a second tray. Wear that for 2 weeks. So each tray is typically a 2-week period, each one being slightly different to apply just a little more pressure to move those teeth to the proper position. The one issue with that is compliance. Obviously, it's not a bracket that's glued to your teeth. You have to wear the trays for it to work. But people wear the trays, it moves the teeth, and it's wonderful technology. It's really fun to see, and it's exciting, and we're doing a lot of that today. So if you have any questions about that, let us know.